Well, lab testing is very important. You can only use or be, as a clinician, aware of, subjective symptoms, the symptoms that the client is presenting. And certainly there are other things, blood pressure, etc., that can be used in helping to understand what the person is experiencing, what imbalances there are that are creating their symptoms. So we do, the fairly typical lab testing with looking at cholesterol and the blood count and liver function, kidneys, etc. But I'd say in many areas we go a little bit more in depth with the types of lab testing we do. Um, we also do use, besides blood testing, saliva hormone testing for assessing cortisol, adrenal function, and also female and male hormones. We do some stool testing, and all this is very important. But there's also so when you're doing testing, you're finding out where the person is right now, where the biochemistry, the hormones are presently. It doesn't really answer too much about what's caused them or what has led up to their symptoms and their imbalance of their various hormones, etc. So there's got to be some degree of a simple sort of Sherlockian type investigation of their past to see the other causes. So lab testing is a part of our assessment, and more in depth than probably most people have had their tests done before. And that is part of the analysis. So I might sit with someone for maybe 20 or 30 minutes and just trying to understand the details of their symptoms and etc. And maybe their chronic fatigue might be partly, it might be thyroid, suboptimal thyroid hormones. It might be some degree of adrenal fatigue. So it's usually not just one thing that's causing their symptoms. It's usually a combination of various things that may not be all that severe, but they're all contributing to their symptoms. So then once we've investigated this, once I've asked them many questions to try to figure it out, then we go to the labs and say, let's see in our lab reports here the reasons for your fatigue, possible reasons for your fatigue. Well, obviously you've got some degree of low red blood cell count, you've got some degree of anemia here. And then look at here, your cholesterol is only 135. Your body doesn't have enough cholesterol to actually make your male and female, your female hormones, and your cortisol is low, maybe because of chronic stress for sure, not enough sleep, but it may also be due to low cholesterol levels. Let's look at a number of different other parameters for in terms of the lab testing. So once we have those understood, I can recommend some ways to improve those biochemical markers. But then again, we need to go a little deeper and to figure out, are we dealing with some pathogens here? Your white cell count is very, very low. Maybe your body's been fighting a chronic infection for a long time. Let's take a look in the microscope. Really just kind of a discussion that kind of moves in different directions and nothing that's kind of planned out, a straight line from A to C. We're going to take these different sidelines and try to figure out what these other causes may be of you not feeling well. So again, lab testing is very important. I don't necessarily base I don't use just only lab tests to figure out what's going on with a person. I want to know from their point of view what they think might be the issues in their life and design a plan that really fits both what we see in the labs and also what we see in a person's history and the insults that have really caused their health to decline.